Welcome to The Drive, everybody. Today we're going to discuss an interesting topic. One of the main things I do in the SHARP method is look for genetic predisposition to have difficulty with detox, and then we really concentrate on identifying toxins in your system so that you know, as well as we do, to the best of our ability in one time, what's happening before you start trying to go through a process of detoxification. And that means a lot of things to a lot of people. So genetically, everybody has a certain way to metabolize hormones, to metabolize carbohydrates and fats, to metabolize things like you're familiar with, like vitamin D, antioxidants like vitamin C, our B vitamins, and something that may or may not be known to a lot of my listeners is glutathione. So we'll just take glutathione for example, because it'll play a pivotal role later. If you're someone who is very sensitive to strong smells, perfumes, smoke, chemical odors, you probably have a limitation in glutathione utilization and in glutathionization in your liver. So glutathione is something that binds with many of the chemicals that we are exposed to, and that binding helps protect us from the chemical. So say for instance, I breathe in smoke that starts to be bound as we process it, and obviously smoke we can't tolerate for very long. Too much carbon in the smoke, and you'll get carbon monoxide, you'll get smoke inhalation injury, all sorts of things that you can't recover from if you get prolonged exposure. But if that is just a brief exposure, or say you're around secondhand smoke, this is probably a better example. Say you're around secondhand smoke. You grew up in a household where people were smoking, but you didn't smoke. So you would constantly be exposed to smoke, and your body would have to detoxify that. If you had a limited ability to do that, you would build up a chemical in your system called NACE, N-A-C-E. And that would show up on a detox test, and we use a urine test to look for environmental toxins like NACE and others. I just use that as an example, but we can go through just examples I've seen in the past couple of weeks, which are really startling when I look at them. And one example in particular is the chemical atrazine, which has been used to spray. And there's all these chemicals that are in herbicides and pesticides. Atrazine is kind of a particularly old one, but it's still used. And our patient had an explant and was improving surgically and doing well, going through the detox process. But I saw her and she said, I'm feeling better, but I'm still not feeling as well, don't have as much energy. And we reviewed her tox test, and it showed she had really high levels of atrazine and glyphosate. So glyphosate is what's sprayed on crops, and when we ingest the food, the glyphosates go into our system. Our body tries to bind them and protect us from glyphosates. So all of these things, like secondhand smoke produces NACE, things like the atrazine and the glyphosates are all chemicals, as well as something that is probably commonly seen on reports, in addition to some mold toxins. I'm thinking of something like parabens. So parabens and methylparabens are found in products. So a lot of feminine products have parabens in them. So one of the things we want to highlight is everybody has a certain level of exposures over time, and depending on where you lived when you grew up. So think of like the water. Where I grew up, there was a high amount of arsenic in the groundwater. That is the most common reason you would have high levels of arsenic in your system. Then, if you think of the quality of the food I ate when I was growing up in the 70s, it was not good. We didn't have organic food, and I remember going to the grocery store with my mother, and honestly, I didn't really eat that well growing up. I didn't like the food, and it makes me think that it was more the quality of the food rather than anything else. Obviously, knowing what I know now, I guess I would have tried to convince my mom to go to a farmer's market, but back then, as a little kid, didn't know any better. And in terms of air quality, my parents didn't smoke growing up, so I was fortunate. So the things that I could have got exposed to, like ACE or something like mold, I think mold's a difficult one, depending on where you grow up and what's the environment. It takes very little to have a mold problem in a home. You can have a water leak under the sink, behind the refrigerator. We can have roof leaks, and it can seep down into walls, cracks around windows, or the doors. I mean, there's all sorts of opportunities for water to create moisture and then develop mold. And then mold is a huge problem with grains and coffee, and some fruits and vegetables, of course, and nuts. So you can reference the podcast I did with Dr. Kyle Landry. He is an expert on all things food. He's a food scientist, expert in fungi. Mold is a fungus. So please reference that show I did with him on my podcast if you want to learn more about that. And I haven't even talked about heavy metals. Heavy metals. So I take a lot of grief about sauna usage, and the reason I try to get everybody to temper their enthusiasm about using a sauna to detoxify is a very special client of ours, Lauren Bostic, Skinny Confidential, famous podcaster. She didn't feel well, and she would, according to her husband Michael, who's on the show as well, she would do these really intense sauna sessions, and they had a barrel sauna to get up to over 200 degrees. She would do it for an hour and a half is what was recalled to me. And so I got on their show. I talked about that, and the thing that Lauren always told me was she thought she was melting her implants. I ended up saying that on their show as part of what we had talked about, and then took a lot of criticism for that. So the process that goes on with these devices that are heated is the shell contains many heavy metals, and the outer shell of the device, like any thing, if it's superheated, it can leach chemicals, and in this case it's going to leach a chemical into your system. Now, when they did studies, they didn't find it in the actual tissues, but we see it come out in someone's urine. So for instance, in the preoperative workup I did for Lauren Bostic of the Skinny Confidential, I found the most heavy metals in any person I've ever seen in my entire career. So how'd that happen? Well, I did her surgery. I did a total intact capsulectomy, or what we used to call in-block capsulectomy, removed everything intact. And in recovery, she was like wide awake, super happy, wanted to take selfies, which was odd. And I said, okay, we'll just see how you do. And day over day, week over week, she felt better and better and better. Now, I was convinced her implants were infected, so I had them tested twice, and they were not. And we do a special PCR test. I published an entire paper about my experience of over 694 patients. 29% have bacterial contamination with Cutibacterium acnes and Staph epidermidis. And so I knew it wasn't infected. I knew she had this tox test that showed heavy metals in her urine, an extensive amount. And so I leave it to y'all. What do you think was going on? Please DM me if you think I was missing something. I feel I'm pretty comprehensive in this. So she did no detoxification. She actually went and spent the summer in Italy on Lake Como. And when she came back, we did a tox test. And what do you know? She had no heavy metals in her urine anymore. All she had done is had surgery. She hadn't done any special chelation therapy or detox therapy, and they were all out of her system. So what's the explanation? The explanation is very simple. Is the device, and specifically the Shello device, was being heated to a point where it was leaching chemicals into her system. Leaching, Leaching. So, that being said, we know you can leach chemicals into your system. If someone were to take a bottle of water, plastic bottle, you could heat that and then test the water and find out there's additional phthalates in the water. Phthalates are environmental toxins that we check as well. Phthalates specifically are plasticizers that make plastic harder. So think of the firmness of a water bottle versus one that's maybe softer and you can squeeze easier. Phthalates help make that firmer plastic. So we have things like phthalates, we have things like parabens, we have atrazine, we have the mycotoxins like aflatoxin A and B, we have fumicins, citronins, Zen, which is basically found from coffee. It's the mold found in coffee. We have NACE, like we talked about. These are all environmental. And so I guess I'll ask you all the question. Do you think we should be testing for this? Because I sure do. I get my tox test now checked. I've had a bad mold exposure. I know how awful it can make you feel. And so it's a thing for certain. So, when we look at these tox tests, I refer back to them, and that helps the patients better understand why they're feeling the way they feel and where they can make the most progress by being diligent and supplementing their genetic pathways. So we use activated vitamin D3K2, we use glutathione, we use methylated B complex, and we use vitamin C. And you're probably listening going, yeah, I do all that. So we use them, and they're all liposomal, which is a liquid-based formulation, because I want my patients to absorb it and get the nutrients that they need right away. So if you were to take a capsule, a hard capsule, or a gel capsule, or a capsule with powder inside, I don't know how you're going to absorb that. I don't know how I'm going to absorb that. So I wouldn't really bank on, and I know this for facts, I did this for several years with my patients. Patients will stop doing things if it's hard to do, hard to remember, if a pill is difficult to swallow, if it's too large, if there's too many of them. So we like these sprays because they're easy to remember, they're easy to use, and I get my patients more interested in their own health that way. So everybody can do better with supplementation. I prefer my liposomal, so when you come work with me, I'm going to put you on my liposomal formulations because we have them balanced out so that I don't stop them for an operation. Where many people stop supplementation for an operation, we don't stop anything. 2, we want you to cut out gluten, cut out dairy, cut out processed foods, because those can have chemicals and preservatives that can affect you as well. And then 3, we definitely want to have air quality improved. I'll give you the example, like I said, of NACE. So anything that has odors, even pet allergens from their fur or from other things that may be used around them, you really have to be careful with the air quality. Fluid quality, I think people are pretty sensitive about water. What I will say is, I don't want you drinking out of plastics for the phthalates that I mentioned earlier. So please don't buy plastic water bottles. Get glass. Use filtered water. Please don't alkalinize the water. That's not necessary. I just want you to drink filtered water. And then the food is very, let's be very specific. I don't care what diet you follow. You can be plant-based, you can be animal-based, you can fast and things. But if you're trying to do better in your diet, the things that I would strongly recommend: increasing the amount of protein, and be careful of the sources of protein. Make sure there's not hormones or antibiotics used on the, if it's animal-based protein. If it's fish, make sure it's wild caught. If it's plant-based, make sure it's not processed with a bunch of soy and other ingredients, chemicals, or preservatives to protect yourself. Shoot for a gram of protein per pound of body weight. So I used to say just try to get 100 grams a day. People may need more. People definitely don't get enough protein in their diet. And then healthy fats are super important. So grass-fed butter is a good source of fats. Healthy nuts are good sources of fat. MCT oil is a good source of fat. Avocados are good sources of fat. So please increase that in your diet. So these are all just basic things, in addition to really avoiding those toxins like we mentioned earlier. And then prioritize sleep. I want y'all to get 7 to 9 hours of sleep, and stop eating 3 hours before bed, if not more. Stop drinking 2 to 3 hours before bed, if not more. And then the hour before bed, definitely get the room cooler, block out lights, any additional noise, and get yourself some great sleep. To learn more, visit my website, drrobertwhitfield.com. I have 5 special things happening right now. We have, if you want to learn more about the SHARP method, our book on audio, or you can purchase it through my store. You can take an inflammation test. So inflammation affects all of us. We have a simple test to start out before our more advanced testing can begin. So you can take that test. You can sign up for a webinar. I just did one last night. And supplementation, the inflammation support bundle has been shown to reduce inflammation prior to surgery and after surgery. So that can be purchased. And then if you're a professional, you want to learn more about the SHARP method, you want to incorporate our principles into your practice, or if you're a surgeon wanting training, you can sign up using drrobstraining.com.